Today we'd like to talk about a new clinical condition that we see presenting very commonly in the office, and this condition has got a lot of publicity in social networks, and that is text neck. Also it could be called tech neck. But the Text Neck Institute describes text neck as a condition that involves the head, neck, and shoulders that is from an overuse syndrome, from excessive forward head posture, leaning forward and bending down, causing excessive strain to the spine or the cervical spine or the neck. And the consequences of this condition are headaches, neck pain, shoulder pain, arm pain or numbness or tingling into the hands, as well as restriction in breathing, and many other conditions. So is this condition a fad or a reality? We can say that it is a reality. This is a condition that is real, and as society and cultures change and how we use technology has changed, it's created some consequences from a health standpoint. Punjabi's book on joint physiology, he states that for every 1 inch that our head translates forward, it adds an additional 10 pounds of weight to the head on the neck. So, if we move our head 2 inches forward, now we have 20 extra pounds of strain or weight that our cervical spine has to bear. So this is real. It's happening. We can like this to something like carpal tunnel syndrome that we saw develop as we developed factory line working, where we were using our hands in repetitive motion, and that repetitive motion created conditions like carpal tunnel syndrome. Now from all the texting and phone use, computer use, iPads, iPods, even e-readers. People were spending an excessive amount of time in e-readers. So it is developing this condition. So I'd like to show you a specific case and explain this case to you so you can see how this truly does affect people. So when we look at the spine from the side, we're looking at the neck. Ideally, we would have what was called a lordosis, or a forward curve in the spine. So I'm going to reference you to a normal picture. This is a picture of the neck from the side, and you can see that there should be a rounded or a forward lordotic curve. So the curve of the neck should actually curve toward the jaw. The first picture we're going to show you, these pictures are of the same patient. We took care of this patient when she was 11 years old. And you can see when we look at her from the side like this is the bottom of the jaw, the back of the head, that she was starting to lose a little bit of the lordosis, but she still had some lordosis in the cervical spine. So she presented to us with some neck pain and headaches. We took care of her. She responded well to care. However, over time, from the use of technology and texting and cell phones, these are pictures that we took just this year. So at this point, she returned to the office, and she was having severe debilitating migraine headaches that at times would lead to vomiting, and she would literally have to be in her room in the dark, incapable of doing schoolwork, performing athletic activities with her team, all those types of things. You can see that in 6 years, from age 11 to age 17, we went from this relatively forward curve to a backward kink in the cervical spine. That's from excessive forward head posture and technology and schoolwork and iPads and iPhones, and literally what we call, here's a live example of text neck. The good news in this case is she was placed on a treatment plan of chiropractic care. We're able to resolve the condition again, and now we are currently working with her to help restore proper alignment and biomechanics of her spine to correct that condition. So, is text neck a real condition? Yes. Are there significant health consequences that could be developed from text neck? Absolutely. Is chiropractic part of the solution to this problem, along with advice on using technology appropriately? Absolutely. So I hope this is a benefit to you, and we look forward to seeing you on your next visit.